So this video is to help you if you're not that familiar with an intratympanic injection, which is of course an injection into the middle ear. So firstly, the equipment you need: a couch for the patient to lie on, a standard outpatient microscope, some suction, a drawing up needle, a 1 ml syringe into which you will draw up the dexamethasone, and a 2 ml syringe into which you will insert your Emla cream if you're using that as a local anaesthetic, or of course if you're using xylocaine, then you'll just need the standard spray. You'll also need a spinal needle, and that's for the injection into the middle ear. So something between a 22 to 25 French gauge works best. In addition, of course, you need the dexamethasone, so that's standard either 3.3 or 3.8 milligrams per ml, which will be used usually in your ICU, so it should be on your hospital formulary. We've talked about the local anaesthetic type as well, and of course before you start, it's most important you've got to consent the patients to make sure that they are clear on the procedure that they're about to have done and what the risks and the benefits are. The benefits are clearly to improve their hearing, and the risks are that in up to half of people may get some mild discomfort in their ear despite the local anaesthetic, just on the injection that is. Less than a quarter of people will feel a little bit dizzy, but only for a few minutes. The more unusual risks are that about 1 in 20 people may get an infection afterwards, and therefore advise them that they should keep their ear dry for a week afterwards. So don't get any water in the ear. Use cotton wool with a touch of Vaseline around it in the outer ear canal when they're having a shower or bath. Now, the other risk that can happen is a hole in the eardrum. Of course, we're making one with a needle, and usually it heals up after a few days, but there's about a 1 in 100 chance of leaving a hole in that eardrum, which could be permanent. Now, the serious but very rare risks would be a further loss of hearing. Now, that would be if the needle was placed through the round window into the inner ear, which would of course also give you extreme loss of balance. Now, to ensure that that does not happen, it's important that you inject into the anteroinferior quadrant, which is well away from the round window, well away from the acicular chain, in exactly the same place as you would do when inserting a grommet.